everyone. And if you enjoyed that hymn as much as I did, we are putting in the chat box how you can access that and share with your congregations using your faith communities if you like. We really appreciate you joining us as we talk about healthcare in North Carolina, specifically Medicaid expansion and improved Medicare for all. My name is Chris Purnell, and I'm the Program Director for Partners in Health and Wholeness with the North Carolina Council of Churches. My pronouns are she, her, and hers, and I currently reside on the unceded lands of the Lumbee and the Tuscarora people. Please feel free to introduce yourself and let us know where you're joining us from in the chat box. Also, if you have any questions or comments during the presentation, please put those in the chat as well. We have lots of folks looking for them, and we'll make sure that we get to them. Our presenter today, we have two topics, so I'm going to make my part short, but our presenter today is really perfect for the after lunch energy drop. As you will hear, she is very passionate about the work she does and her belief that healthcare is absolutely a human right. And it is possible to achieve. It's not quite as complicated as you may have been led to believe. She won't be able to cover everything in this 1 hour session. Healthcare is a complicated issue. It does take a desire to really get in the weeds and learn what's true and what isn't. It's really my hope that you come away from this session knowing that the Council of Churches and our partners have resources to share and are fully committed to achieving healthcare equity. So now let me introduce Rebecca. Rebecca Cerise is a justice activist. She's an award-winning documentary filmmaker and a passionate healthcare advocate. Her first documentary, February 1, The Story of the Greensboro Four, has been broadcast as part of the Independent Lens series on PBS and has been screened at the National Archives, the Smithsonian of American History, the King Center, and at film festivals around the country. She's the first ever health engagement coordinator with the North Carolina Justice Center, where she collects stories about people who are uninsured in order to push for policy change. She's also the co-lead of Healthcare for All Y'all, a board member of Healthcare for All North Carolina, and is one of the founding members of the North Carolina Medicaid for All Coalition. I'm very grateful for her work in this world, and we'll turn it over to Rebecca.
Thank you so much, Chris, for that lovely introduction. I'm really happy to be with you all today. I do have a lot to cover, so I'm going to sort of just jump in. So let me get my PowerPoint up. And like Chris said, I'm going to sort of take a view that is statewide and then sort of more a countrywide view. So expanding healthcare in North Carolina, Medicaid expansion and beyond. Wanted to start off with sort of a big picture on healthcare. And it's sort of a little bleak, so I'm sorry about that, but millions of Americans have lost their jobs and with it their employer-based insurance. Too many of our frontline essential workers have no health insurance. People who are undocumented have very few options for healthcare. Racial disparities in healthcare are leading to Black and Brown communities suffering from or dying from COVID disproportionately. And due to COVID-19, our life expectancy has actually dropped by a year, 1 year for whites, nearly 3 years for Black folks, and nearly 2 years for Latinos. So on the health front, we're not doing great, but the good news is there are actual solutions out there, and that's what we're going to be focused on. Wanted to start off by grounding us in what this work is really about, which is the human beings. The healthcare is a human right. There are actual people across North Carolina and across this country that are suffering because we have a pretty terrible healthcare system in this country, although we're the richest country in the world. So I want to introduce you to India, and here's her story.
My entire life, my family's been in medical debt. I literally think about my health problems and my future and just the medical debt that my family's in every day. It never goes away. It's not right. It's just not. And I don't know who decided that being healthy was a privilege. I am 27. When I turned 26, I aged out of the state healthcare policy that I was on because of my father's work. And I have not been able to get any kind of insurance since then. I'm currently unemployed because of COVID. I worked in a restaurant. My boss, understanding of my situation, my whole family's high risk. My dad has asthma. My mom with her autoimmune diseases, my boss sent me home before we even had lockdown. But even when I was working, I didn't qualify for Medicaid or the ACA. And so I have been sitting on no insurance for almost 2 years now. And that's a terrifying prospect in the middle of a global pandemic when you're a high-risk individual. I have clinical depression. I am recovering from an eating disorder, and I can't go to therapy. I also have to have reconstructive surgery on my nose, and that cannot happen until I have some sort of medical coverage. And if I don't have this procedure done, I will lose my ability to breathe through my nose and to smell by the time I'm 40. If we had Medicaid expansion in this state, so many problems would be solved. And if we don't have leadership in place who's willing to talk about that, who's willing to advocate for it, it's going to stay that way. And people are going to keep dying. I just think it's important that people realize that. And I think it's important that we do all that we can to convince people to take the steps needed to make that change happen.
So that is India.
My entire life.
Oh, and there are sadly many, many Indias across North Carolina. I have spoken to many folks, each person with a story more heartbreaking than the next. And I have actually I just found out one of our storytellers, Deanna, who had a heartbreaking story, actually passed away recently. So this is the kind of real world life and death situations we are dealing with our healthcare. So wanted to just give a little bit of context for what we mean by Medicaid expansion. So want to do a walk down memory lane. I decided a very brightly colored walk down memory lane. March 23rd, 2010, we had the Affordable Care Act was signed into law. And of course, what that did was offered protections for people with pre-existing health conditions, financial incentives on the marketplace or healthcare.gov for people earning 100% federal poverty to 400%, allows children up to age 26 to stay on their parents' health insurance plans. You heard India talk about that. And then the last was expanding eligibility for Medicaid for up to 138% federal poverty. The whole idea was, how can we cover the most people under this new law? And Medicaid right now only covers people that are like 40-something% federal poverty. Also, if you don't have dependent children, you're totally ineligible for Medicaid, no matter how little money that you make. So there's a big, and we'll see in a minute about this coverage gap. There's a lot of people that fall into it. Now, unfortunately, what ended up happening is they took a bunch of states took the ACA law to the Supreme Court, and what they found was Medicaid expansion could be optional. And so, of course, we did not expand Medicaid in North Carolina, and we're still fighting that fight 10 years later. So, like I mentioned, with the coverage gap, it's the people that are between 40 FPL and 100 FPL. They basically have no options for insurance. They don't get subsidies because they make too little. I know that's a weird thought, but they make too little to actually get subsidies. And they're not eligible for Medicaid for a variety of reasons, many of which are because they don't have dependent children. So that leaves a giant group of people completely unprotected. That's the coverage gap. So some of the top industry sectors, accommodation and food service, administrative support and waste management, construction, healthcare and social assistance, manufacturing, and retail. And in other words, many of our essential workers, who are disproportionately people of color, are uninsured in North Carolina during a pandemic. And of course, that is just bad news all around, because there are over 1 million uninsured North Carolinians right now. So what happens when someone is uninsured? They skip routine screenings, doctor's appointments, and filling prescriptions. What happens then? They get sicker and end up oftentimes having to use the emergency room. there you go. People wait until advanced stages of disease to get the care, risking permanent disability. I have a storyteller, Diane, who I interviewed, had diabetes, lost her insurance because she lost her job, and had could not manage her condition, ended up having heart attacks, all these different things, just because she could not afford her insulin and manage her diabetes. People accumulate medical debt or experience bankruptcy. People miss work and may lose their jobs. And uncompensated care in the ER increases with the higher rate of uninsured. And of course, it really gets hit hard in traditionally underserved areas and rural areas in particular, which is why our rural hospitals have been struggling, this huge burden of uncompensated care. We have about $1 billion in uncompensated care costs yearly. In this state. And what happens when people don't do those things? It ends up exacerbating if there is a public health crisis, which I believe is why we had such high numbers. And of course, again, sadly, disproportionately impacting our Black communities and our other communities of color in terms of death rates and illness rates, but also our rural areas were hit really hard, just outside of all of that. And actually, you know, per 100,000 cases had higher rates than some of our urban or suburban areas. So let me give a quick recap of our North Carolina Medicaid expansion fight. The NCGA refuses to expand Medicaid. Then they pass a law that makes it impossible for the governor to expand Medicaid. And then they continue to block Medicaid expansion. In 2019, which seems like ages ago, but there was the budget stalemate. I don't know if a lot of you remember that Governor Cooper decided to veto the budget after his big priority of Medicaid expansion was not in it. This created a stalemate, and we have been operating without a full budget for the last 2 years. And now we're ramping up for the next budget fight, which I'll get to a little bit more in a minute. So the great thing is we have additional tools to fight now for this as we're going into this budget fight, which is where we hope the expansion is going to happen. There have been some bills introduced on the Democratic side for expansion, but to be completely frank, they are not going anywhere. So the budget fight, the conference report, which is the joint budget submitted by the House and the Senate, is really our best bet now for getting Medicaid expansion in North Carolina. So what does the American Rescue Plan offer us? It has several primary healthcare impacts. It protects coverage and increases the care affordability for Americans. So it increased subsidies for the marketplace, and also, much to my chagrin, offered to subsidize COBRA at 100%. We can talk a little bit more about that in a little bit. It funded vaccination efforts, which have been really, really important. I mean, the fact that vaccinations have come out and are free, that's a great thing. And address substance use and mental health concerns. And there certainly are a ton of those, even before the pandemic, but totally exacerbated by the pandemic. The really exciting part, you'll see behind me, the Southerners for Medicaid Expansion. Last year, the 8 Southern states, so there are 12 states that have not expanded Medicaid. 8 of them are in the South. So the 8 Southern states that have not expanded Medicaid decided that we were going to regionally organize. And we had a big digital vigil on October 1st, headlined by Reverend William Barber and moderated by Stacey Abrams. And we really outlined the similarities in our states in terms of rural hospitals closing, in terms of, us being negatively impacted by COVID-19 because we had so many uninsured, and on and on and on. And because of our organizing, and this is an exciting part, how advocacy can actually work, because of the organizing we did, when they were negotiating for the American Rescue Plan, we actually got a really amazing piece put in there, which would actually give 5% increase in the federal government share of traditional Medicaid. So this is not the Medicaid is run by is basically administered and paid for by the federal government and the state government. And traditionally, the federal government picks up about 60-something% of the cost, and then the state covers the rest. Our traditional Medicaid population is about 2.2 million people right now. So we had originally wanted them to push like what they would pay for expansion back up to 100%. But what we ended up getting was we had a 5% increase in the federal government's match for our traditional Medicaid program for 2 years. And that's on top of the federal government paying the enhanced 90% match. So for the expansion population, the federal government actually pays 90% of the bill, so much more than traditional Medicaid. So they will continue to pay 90% of the bill for expansion if we expand it. But on top of that, we will also get this 5% bump for traditional Medicaid. And what would that be? So that 5% bump is estimated to bring in $1.7 billion to North Carolina over 2 years. And our state share to expand Medicaid would be about $490 million a year. So we would actually, just from this money alone, have the ability to pay for our state share for a couple of years and really not have any kind of that the state would not have to even pay anything for the next couple of years. So it's a really really great deal that is really, really hard to pass up, which of course doesn't mean that our legislature won't pass it up, but we can always hope. And there has been some rumblings that there might be a sea change. I don't want to get overly optimistic about it, but I am cautiously optimistic that we actually might see some real movement on this. And on top of that, of course, besides the money coming in, we would have over 682,000 North Carolinians gain coverage, which again is what this is really about. You know, people should not be uninsured ever, but in particular during a public health crisis when everything is just so crazy, not just with the contagion of COVID, but again, mental health issues, substance use disorder issues, on and on. So who would benefit? Of course, great people of color who were disproportionately impacted by us not expanding Medicaid and by COVID would benefit greatly from expansion of Medicaid. And actually so would rural North Carolina. As I mentioned, they've been hit hard. The green dots are where rural hospitals have already closed. So expansion and this extra money coming in would be a win-win for rural North Carolina as well. And the truth of the matter is that NC voters back expansion by big numbers. And there's been several polls, including one that's not on here that was done by Care for Carolina, one of the coalitions that also advocates for Medicaid expansion. And it was similar numbers, huge support across the political spectrum for Medicaid expansion in North Carolina. And so I'm going to take a step back for a second. I wanted to also just tell people about some additional things that were in the American Rescue Plan that have real relief for people who are uninsured. First off, the COVID-19 vaccines are free to everyone, no matter insurance or immigration status. So if anyone is worried because of our for-profit healthcare system about having to pay lots of money for the vaccine, we need to, get the word out there that no, the vaccines are free. Another thing is, and this is amazing, so treatment for COVID-19 or any kind of illness that stems from a primary diagnosis of COVID-19 is actually free for uninsured people, thanks to the American Rescue Plan. And that is retroactive back to February 4th of 2020. This is good news for folks who are uninsured. And in particular, so if you are uninsured, providers must give you back any money you paid for COVID-19 treatment. And sadly, my guess is you will have to call them and be proactive in this. But nonetheless, this is your right. And if someone was put in collections because of it, same thing. Call your billing, the billing department of the hospital or provider and let them know that they can actually submit the claim and get reimbursed and to take you out of collections. And then the last one is a little bit sadder, but just wanted to let people know is that if you do have a loved one who passed away from COVID-19, FEMA is offering financial assistance to cover funeral costs. So those were just, some real tangible relief for people who are uninsured that were they're my favorite health provisions that were in the American Relief Plan, because it's free treatment for uninsured people. And I believe that we should have, quote, free treatment, which of course really just means paid for by the taxpayer, because nothing is free, but for uninsured people for this. So the other thing I wanted to talk about real quick, just a lay of the land, is we are also going through Medicaid transformation in North Carolina, which is basically a complete overhaul of our state's largest public health insurance program. I will keep my opinions about this close to the vest, but it is moving forward. We are changing to a managed care system. Open enrollment has begun, and the coverage is set to start on July 1st, 2021. And the NCGOP leadership has said that we couldn't expand Medicaid until we transformed it. So now we're waiting to see if Medicaid expansion is going to happen now that transformation is about to go live on July 1st. So in terms of state action, I want to talk to you about what you can do right now for expansion. We're not planning anything big and overt yet, because we really want to sort of be strategic, and we want to really play our cards right in terms of how to best influence people maybe on the other side of the aisle, the GOP side, because it's going to be them that are going to have to put this into their budget. But what we can do is we can absolutely make sure that the public knows that this is a very, very important issue. We could submit letters to the editor, to our local papers. We have some talking points for you at that link that I know is going to be dropped into the chat. You can share your story with me. You see what I was able to do with that story with India, even via Zoom. Stories are powerful. And even if they don't impact, you never know when they're going to impact our legislators, but even if they don't, they impact people. And in the end, we really have to get a groundswell of support for this from across the aisle, to push this policy. You can go to our justicecenter.org link and press the Take Action link and sign up for healthcare updates, because if the expansion is not in the conference report, then we are going to take bold action to really show that this is completely unacceptable, and we can no longer we are not going to stand by and let North Carolinians continue to be unprotected. Also, a bunch of us have been working with the People's Budget Coalition. Medicaid expansion is one of the planks on the People's Budget 3-plank platform. The others are about housing and workers' rights. So you can also go and sign on to that as an individual or for your organization. And we're trying to get a lot of sign-on to that too. There's a lot of unreserved money that's been left on the table, over $5.5 billion that they could have been spending to help people during this pandemic that they have not. And we want to push them to spend it on the people's priorities, which is where they should be. So that is what I'm going to talk about in terms of Medicaid expansion. And now I'm going to sort of take off the Justice Center hat and talk about Medicare for all. So why we need Medicare for all and not incremental change. I am all for Medicaid expansion. It is something we can do right now to help people across North Carolina. But the truth of the matter is it's still only a Band-Aid on a gaping wound. It is not going to impact the people who say are underinsured. So that's people who have insurance that can't use it because of high deductibles. So what are we supposed to, Medicaid expansion won't help those folks. There's also a group of uninsured folks that for different reasons are not going to be eligible for expansion. And what do we do for those folks? If we truly believe that healthcare is a human right, then it actually needs to be universal. So before I go further, I just want to point out that there has been a well-funded mass misinformation campaign that's been going on for decades around Medicare for all, because there are a lot of companies, insurance companies, big pharma, that are making record profits off of our cruel, inhumane, for-profit system, and they want to keep people fooled about what we mean by an improved Medicare for all system. And the reason we know this is because Wendell Potter worked for an insurance company, and he turned into a whistleblower. And he was the person who was in charge of putting together the focus groups to figure out how to muddy the waters around messaging. And he had a literal come to Jesus moment when he saw a pop-up clinic, and he saw people waiting online for overnight just to get health care, and some people waiting days to get dental care. And he realized that he was part of the problem. One such organization that is working with this misinformation is called Partnership for America's Healthcare Future. And it sounds really good and innocuous. It's not. They're purposely working against a real solution for universal coverage for everybody. So like I said, even before the coronavirus pandemic, we were experiencing a healthcare crisis. But COVID-19 has really highlighted the need to create this universal system with no cost barriers to care. It's not good for anyone when we have uninsured people who are essential workers and without paid leave, I might add, who can't take off when they're sick, who are going to go to work sick and, during a contagious pandemic. That's just not good public health in general, and it puts everybody in danger. So I'm just going to quickly go over the problems with our current system. I'm sure a lot of you know, most people I know have had some horrible experience, either themselves or their loved ones, with our expensive, inefficient, and unsustainable, and not working for most of us, current healthcare system. So the US healthcare system is the most expensive in the world. We pay almost double what other developed countries spend per capita on healthcare. However, yet millions of our people are without adequate health coverage. Even before COVID-19, 87 million of the people, or 45% of people who outside the ones who are eligible for Medicare, so 65 and older, were either uninsured or underinsured. Again, underinsured is having insurance but not able to use it because of huge out-of-pocket costs. And more people with health insurance were uninsured than in I think that says 2010. And the highest increases are for people with employer-based plans. So you know how we're always hearing about people loving their employer-based plans? Well, those plans have gotten worse and worse over the years, in particular since the marketplace. Marketplace plans have gotten worse and worse, and have also have a large out-of-pocket, creating underinsured plans that leave people underinsured. And of course, this has also shown us how reliable and effective is an employer-based health insurance when millions are laid off during a public health crisis, right? Just does not make sense to continue to tie health insurance to employment. It also really gives your boss a lot of impact over your life, which is really strange. They can pull it from you. If you're in negotiations for higher wages or health, better health care, they can just stop your health care. That is not something that is not a power we should be giving to any employer. So I was telling you about the mass misinformation campaign. One of the big lies we always hear is how we have the best healthcare system in the world. That is categorically not true. Our outcomes are worse than many other countries. We have lower life expectancies. We have the worst maternal death rate in the developed world. I'm going to repeat that, the worst maternal death rate in the developed world. And we have higher infant mortality rates, really terrible as well. And there's a whole other host of things that have areas where we are not doing well in terms of outcomes, or our outcomes are totally tied to our socioeconomic status or our racial status. And in fact, we're experiencing catastrophic and unacceptable racial health inequities. You can see for Black women are 2 to 3 times more likely to die during childbirth or the year following childbirth than their white counterparts. African Americans, Black folks have higher rates of blood pressure, diabetes, and stroke, and just overall die earlier from almost every condition than white people. So it is not only is it just a terrible system, it's also an incredibly racist system. So, and then of course, our for-profit system is forcing our people to beg strangers for money on GoFundMe. How many times have you seen GoFundMe campaigns to cover essential medical costs? 1 out of 3 GoFundMes are for medical bills. And that is a sign of a system that isn't working. We're also the only developed country that allows its citizens to go bankrupt because they got sick or had an accident. And many of those folks that are filing for bankruptcy are uninsured, but they're suffering from that underinsurance, or they got, tacked within a surprise bill, or they ended up, having an anesthesiologist who was out of network, or there's a whole host of ways that people rack up medical bills in our incredibly complex system. So how did we get here? We chose policies that favored a privatization corporate model over a public model. So we have commodified healthcare in this country. So private insurers increase profits by denying us care. So there's a perverse financial incentive to deny us care in order for them to increase profits. And that is the role of a corporation, is not to actually give healthcare, it's to increase profits for its shareholders, which is why a for-profit system in healthcare do not work, because we are the most expensive when we need the help the most. And so that's always going to be the time when these companies are going to try to deny us care. So we are paying private insurers to restrict our access to care and stand in the way of provider and patients making decisions about their health. I think that cartoon is very apt. We always hear we don't want the government between us and our healthcare. Well, we already have an entity between us and our healthcare, and they have a profit motive to deny us care, and they have been denying us care, and it has led to catastrophe after catastrophe for families across our country and state. But the good news is there is actually a solution. We call it improved Medicare for all. We're already paying for it because I told you we pay double what other countries spend, and it's a sustainable and fiscally responsible way to pay for healthcare. So like I mentioned, our current system is a multi-payer system. It's chaotic. We have public, private, tons of administration, tons of bureaucracy, redundant bureaucracy. Most hospitals have more administrators than they do providers. And of course, private companies are the ones that are making the decisions about our care. Improved Medicare for all, on the other hand, is simple, a single payer. So a lot of you have heard that before. All that means is one entity is responsible for paying our medical bills. And that would most likely be something like the Center for Medicare, which already exists. So the doctor or hospital would send the bill there, they would send the payment back. The end. See, very, very simple. And more importantly, the important medical decisions will be left to the healthcare provider and the patient. And once enrolled, you never have to choose a health plan again. I don't know, I'm lucky I have an employer-based plan right now, which is decent. I would still change for this in 1 second. But when I didn't, every year I had to think about open enrollment in the marketplace. It would stress me out because it's so difficult to understand what they're saying. You need a PhD. Don Berwick, who used to be the head of the Center for Medicare and Medicaid under Obama, said that he doesn't even understand it. And maybe he was being facetious, but I totally understand what he's talking about. So what are we talking about in terms of Medicare, improved Medicare for all? So it's comprehensive. So just introduced was a bill, HR 1976, the Medicare for All Act of 2021. It covers all US residents from birth to death. So residents, that includes everybody. Estimates out-of-pocket costs, eliminates out-of-pocket costs. So we have no more premiums, copays, or deductibles. Instead, we pay for the healthcare through a progressive taxation system. It expands coverage to include dental, mental health, hearing aids, vision, prescription drugs, home health care, and long-term care. So comprehensive benefit package. And in the new bill, they have something that states that in no way can we ever make the benefits worse. We can only improve them. So we can only add to the benefit package, not take away from it. there are cost control measures in there, like global budgeting for hospitals, negotiating prices for drugs and medical devices, things we are not doing right now. There's also substantial investment into medically underserved areas. And in this bill, they introduced the idea of an Office of Health Equity that will be able to really oversee this and make sure that these communities are getting the investments that they need and deserve. Especially because they don't have to, these providers don't have to worry about making a profit. They will actually be compensated by this national system, right? And then this is one of my personal favorites, and there's a lot of talk about this right now, actually, and drug patents if companies price gouge. We're seeing that right now with the vaccines. The vaccines a lot of them were created with science that was based on research that was done with public funding, and yet they're not releasing the vaccine so that other places can manufacture, so we can create generic, so other places can manufacture them, and we can get them out quick enough to really help people around the world. Because again, when you have a global pandemic, it doesn't just stop at our shores. But this would actually undrug drug patents of companies price gauge in general, which for, you know, anyone that has someone they love who's a diabetic knows that the insulin prices have been jacked up and jacked up and jacked up. And that would not be allowed under this system. So, you know, we're always asked how we're going to pay for it. I told you it would be a progressive taxation system. There's a lot of ways, there's a lot of papers about it, but wanted to just point out one surefire way to save money is to take the profit motive out of healthcare, which will lower costs for everyone and help us pay for it. Why are we okay with insurance execs making millions while regular people are facing financial ruin because they got sick? And then why are Americans putting off going to the care because of getting care because of costs, even if they have symptoms, while insurers are making record profits? Yes, insurers, for-profit insurers like United Health made record profits last year during a pandemic, while so many of our fellow Americans lost their coverage. So why hasn't Congress fixed this? Unfortunately, we have a lot of people in Congress that are very influenced by their campaign contributors. And like I said at the beginning of this with the mass misinformation campaign, there are billions of dollars being put in to keep the system the way it is so that the money train can continue on for the insurance companies and the pharmaceutical companies. And that's why we need to really build a groundswell of people who know the facts and can fight for this. So the last thing before I sort of go into where we are now that I wanted to touch on, because people are always talking about this, improve Medicare for all will control costs and provide universal coverage, but a public option will not. You'll hear a lot about a public option, but the truth is, preserving any aspect of private health insurance perpetuates the problems of being fragmented, multi-payer, and for-profit. So the costs are still driven by profit motives. It remains wasteful and inefficient due to the redundant billing. So none of that would change if we just had an option that was public. The rest of it, the whole multi-payer system problem that I talked about earlier would remain. There's these constantly changing rules for pre-authorizations, facilities, and networks. That would not go away. Decentralization, so not having one giant risk pool would mean that it would be much more difficult to negotiate for the different things like drug prices, equipments, and devices. There'd still be continued out-of-pocket costs for things like copays, premiums, and deductibles, which end up being cost barriers to care for people. And the truth of the matter is insurance companies would be able to manipulate the system to put the sickest people into the public option, making it expensive and unsustainable. So I would argue that unless it's a highly, highly, highly regulated public option, it will actually be a bad thing for the improved Medicare for all single payer movement, because it's going to potentially blow up in our face. So the other piece is gaining a public option is going to require a huge amount of political capital. So why don't we just use that political capital that we're going to have to use anyway on actually solving the problem, which is creating a universal single payer, not for profit healthcare system in this country. Wanted to just bring up something that just happened this week, which I think is potentially something very exciting on the road to achieving Medicare for all. Over 80 House Democrats, both progressive and moderate, are pushing to expand Medicare to cover people who are either 55 or 60, allow Medicare to negotiate drug prices, and expand services to include dental, vision, and hearing aid. So this letter just went to President Biden and Vice President Harris, and there really does seem to be a fight that is ramping up between people that just want to continue pouring money into into the marketplace and our for-profit system, and then people that are trying to really get us on the road to expanding Medicare to cover everyone. And this is a really amazing first step. So as of now, only Representative Alma Adams and Representative Kathy Manning have signed on. So there's definitely opportunity to take action around this. And I actually think that this is a really exciting turn of events, and especially since it's both progressive and moderates. So the other thing I wanted to tell you about is this opportunity for transformational change in North Carolina. So I am a proud founding member, and the Council of Churches is part of our coalition, one of the 39, it's actually 40 now, diverse intersectional organizational partners working, and it's part of the North Carolina Medicare for All Coalition. We held legislative, so a bunch of us decided we wanted to amplify each other's efforts. People were working on this in different parts across the state, but there wasn't a centralized clearinghouse. So we met last January and started the North Carolina Medicare for All Coalition out of nothing. Now we're 40 organizations strong, many individual members, and we've really been able to harness that power. We held legislative visits with all 5 Democrats representatives in our congressional delegation to get them to sign on to that HR 1976 bill that I was telling you about. Representative Adams was an original co-sponsor. Representative David Price did sign on after we did put pressure on him. So he signed on, but sadly, Representatives Butterfield, Manning, and Ross have not signed on, but they've also not given us a no. So there's lots of room to push there. So we have a unique opportunity through the power of our coalition to put pressure on our current lawmakers to do the right thing. We also have an opportunity to meet with people who are or will be running for office to get them to run on Medicare for All as one of their policy platforms. We've already started to do this. With the people that are running for Senate to take the, to hopefully win over the seat in 2022. So here are some ways to take action around Medicare for All. You can join the coalition and sign on to our letter. You can use our toolkit to call your electeds about supporting 1976 and also about signing on to that letter that I was telling you about that wants to expand Medicare right now to include people 55 or 60, expand it to cover vision, dental, and hearing aids, and negotiate drug prices. You can join the brand new Faith Health Caucus that is being headed by, co-led by Mary White and Chris Parnell right now. And you can email Chris if you're interested in joining this Faith Caucus. The faith voice, I believe, is going to be essentially important in this fight to make that moral argument, about why this is an essential fight and why this is something we must do. You can also register for our next Medicare for All Coalition orientation session. We have these core meetings of our coalition the first and third Wednesday of the month. And before each of them, we have now these onboarding sessions, which just sort of give you an introduction to the coalition, what we're about, how we communicate, what we're trying to do, what are our campaigns, that sort of thing. So that is my presentation. I will stop sharing the screen, and I know that was a lot of information, but I'm really, really happy to take any questions that you have on either Medicaid expansion or Medicare for All.
Wow. Everybody take a breath. I told you she was passionate about this topic and very, very well informed. That was a ton of information. Please know that we have all of that on the website. The council has a lot of information and are happy to, as we did last night, we actually, another founding member of North Carolina Medicare for All, did a presentation for a church in Raleigh that wanted to share it with their folks. So happy to do that as well. Are there any questions that anyone has that they would like to put in chat? I have a couple that were sent that I would like to share. And this one we get a lot. We hear so many different names: universal health care, national health plan, single payer, Medicare for all, government run healthcare. Is there something are there differences in those things? And is there something that is more palatable to our lawmakers?
That's a really, really good question. It's sort of hard to know. I think things change, but universal health coverage has been sort of used as this catch-all. When people in our movement use it, we normally mean like a not-for-profit single-payer universal system, right? Medicare for all is just used because, for the most part, people have very good feelings about our Medicare system. You know, once they turn 65 and sort of have this, this coverage that they can take anywhere across the country, which, by the way, that you cannot do with Medicare Advantage programs. Medicare Advantage programs is the privatization of Medicare and actually only gives you limited networks. So that's something to be careful about because they're trying to really push those Advantage plans. But that's sort of where the Medicare for All moniker came. We say improved Medicare for All, though it's a mouthful, because we know that Medicare right now leaves a bit to be desired. There's still that 80-20 cost share. It doesn't cover everything, you know, those sort of things. So that's why we added the improved. The reason we're still sticking with Medicare for All is because really the Bernie Sanders campaign really introduced it into the collective consciousness of our country and brought it forth. And so that we want to make sure that people understand that we're sort of talking about that same thing. Government run healthcare is not accurate because what we're actually talking about is something that's publicly funded but privately delivered. So for Medicare, for example, your doctors who take your Medicare are not employees of the government, and the government has no say over what your doctor is going to give you or not. They are just there to pay the bill, and that's really, so that's really what I say to that. Again, we're just talking about a system that will be not for profit, that will cover everyone, that will control costs, because our costs, healthcare costs, are out of control. It takes up a giant chunk of our budget for the entire country, and it's not sustainable because it keeps growing. And one of the things that I didn't mention is there have been multiple studies now, including a Congressional Budget Office report, a study by Yale epidemiologists that was published in The Lancet, that shows that over 10 years, this not-for-profit improved Medicare for All system will actually save us money and start to control costs. Plus, if you have everyone who has access to screenings, to preventative screenings, to a doctor at the front end of their illness, all of that, we're going to have a healthier populace overall, which will, of course, also bring down, you know, healthcare costs in the long run, because we won't be treating people who are at this stage of sickness that we do now on such a big level. And like I'd mentioned earlier with the rural hospitals, folks come in, they wait because they don't want to be stuck with the bill or to face bankruptcy. And by the time they come in, they're incredibly sick. They're going into the emergency room, which is the most inefficient, expensive care that you can have. And again, that's not good for anyone, because hospitals still have to, you know, pay bills. And so they end up jacking up prices for everybody if they have lots of uncompensated care. So having everyone be covered is just better overall for everyone. So that's basically the different names. And in terms of what to use in different groups, it's a hard call, honestly.
That makes sense. Thank you for clarifying that. Very important. I just want to lift up a comment in the chat box that cannot be said enough, I don't think. In addition to the details, you truly undermine the notion that healthcare is too difficult to understand. The way healthcare is right now is so confusing and difficult. And if you've ever watched someone even try to sign up for Medicare, it's torturous. The Affordable Care Act, like you mentioned, but it does not have to be that way. If you're truly dedicated to healthcare as a human right, there are systems all over the world that are working very well.
That are simple.
That are simple.
That are simple.
Thank you, Tim, for that.
The more I look into healthcare policy as part of my job at the Justice Center, the more I am blown away by how absolutely complex it is. I always say, I think a crazy person is writing healthcare policy, because it cannot be more convoluted, more complicated than it is.
Yeah, absolutely. Thank you. So one question is, will Medicare for All in North Carolina reopen maternity wards in rural hospitals that have been closed?
Well, that's the hope. That's one of the ideas, is that the whole idea is these underserved areas where, say, a labor and delivery isn't going to get a profit for the for-profit hospital system that has opened up, which is why we're losing these labor and delivery rooms. The whole national system is going to say, do we need a labor and delivery here? And if yes, they will fund it. I believe, yes, I believe that this is actually going to lead to an expansion of healthcare across the board, across North Carolina. Rural hospitals will be on sound financial settings because they'll be getting money coming in all the time for these different things. And yes, if this national system says, wow, okay, there's a lot of people having babies in this area, let's fund the labor and delivery department.
Awesome. So another question, can you talk about the possibility of pregnancy Medicaid expansion to 12 months postpartum?
Yes, great question. So right now, in a horrible, horrible way, most women lose pregnancy Medicaid 2 months after they have a baby, which, as you saw from those maternal death rate numbers that I talked about, maternal death can happen anywhere within that year, and from a variety of factors. So it's very, very important that folks are actually given coverage. One of the things that the American Rescue Plan offered was that ability to expand Medicaid to 12 months postpartum, and on top of that, expand the benefits. So it's not just family planning Medicaid, but it's actually full Medicaid. And so a woman can actually get any issue she has addressed, not just ones that are tied to her reproductive system, which is really, really important. There is a bill, a couple bills, I believe one of them does have bipartisan support. I think that this is going to happen in North Carolina. I think that there is definitely appetite in a bipartisan way to push that forward.
Awesome, thank you. I think we have time for at least one more question, and one that comes up often is, how do medical providers feel about this?
That is a great question. So I would say the majority of medical providers are for this. There is a group called PNHP, Physicians for a National Health Program. They also have student chapters. There are 3 chapters just in North Carolina alone: Healthcare for All NC, Healthcare Justice NC, Healthcare for All Western North Carolina, that do support this. And then 2 years ago, the American College of Physicians, which is a majority specialists, actually came out in support of Medicare for All, which was huge news that, of course, got no coverage because it goes against, the narrative that nobody supports this. So I think, and I think providers have a huge role to play, just like people of faith, in also converting the non-believers right now. Because I will tell you this, I cannot tell you how many doctors I have spoken to, many of which have broken down in tears because they cannot treat their patients the way they were trained because of our broken healthcare system right now. And these people end up getting sicker in front of their eyes and even dying. And so it leads to massive doctor burnout. And so I think more, and I think that's why you saw the American College of Physicians jumping on board, because it's really difficult to be a doctor. If you got into it because you want to heal people, that is practically impossible in our current system.
Absolutely. So one last question quickly is there anything we can do for Medicaid expansion now? Julie says she is in a Republican district and talked to her rep who said 5% premium contribution was a contentious issue.
Yes, there's all sorts of things that they want to put in there, potentially. So I think like I said, the best bet is going to be in this budget fight with the conference report. We're trying to sort of lay back, but what we are doing is really just trying to elevate the issue of expansion without pushing too hard against, say, Republican lawmakers so that they, dig in against it, right? We want it to be a very welcoming atmosphere for them to come on board because they are in charge and it will be up to them whether to include it. I don't think it's a bad thing to call your representatives. I think if you can write a letter to the editor in your newspaper about why this is important, talk to the people in your area about why this is an important policy issue. Healthcare is not partisan. It has turned partisan in our country, in our state, but it's a human issue. Cancer doesn't care if you're a Republican or you're a Democrat, okay? Like car accidents don't care, if you're a progressive or a conservative. We all need healthcare, and it should be there when we need it without having to face financial ruin. It's a human issue. It's at the core of who we are. And we are the only developed country that does not offer this to their people as some sort of human right. And it's instead a privilege. And in the richest country in the world, that is just unacceptable. And the only way it's going to change is if we stand up and really, with enough voices, say it's unacceptable.
Thank you. Thank you so much, Rebecca. And thank you all for joining us today. Please let us know how we can assist you if you would like to work on this issue or you're already. We really appreciate the advocacy that we've already seen shared in the chat box today.
Thank you so much.
Thank you. And we will close out as we have every session this week with a litany, which here we go. Feel free to join. I know your mics are off, but we can appreciate your collective voice. God of peace, you have shown yourself to us as one who demonstrated what true power looks like by refusing to use violence. We are willing to follow your way of peace. God of justice, you have invited us into peacemaking work by showing us that justice is the first ingredient. We are willing to work for your way of justice. God of righteousness, you have provided the means for all creation to flourish when we walk your righteous path. We are willing to be your righteous people. Thank you all. Have a great afternoon.